An outbreak of the deadly Nipah
The
virus
outbreak of
in
Nipah
West
virus is
Bengal.
raising alarm
Threat
after the
of a
virus
deadly
outbreak has
virus.
been reported in
India
India's
says
West Bengal.
it has contained its 2 cases of Nipah virus.
In this video, we're gonna discuss about where was the first case confirmed, until now in which country it causes outbreak, and in which class of virus it belongs, how does it transmit, what are the symptoms of this infection, how is it diagnosed, how can we treat it, and finally the preventive measure of this virus. Nipah virus was initially discovered when it caused an outbreak of virus encephalitis among pig farmers in Malaysia between 1998 and 1999. The virus was named after a village in Malaysia named Kampung Sungai Nipah, where the first patient with confirmed case. It already caused an outbreak in Singapore, Philippines, Bangladesh, and in India. In India, it causes outbreak in Kerala in 2018 and recent outbreak in 2025-26 in West Bengal with 2 confirmed cases. So let's discuss about its classification. In this old virus is mainly classified as RNA virus, DNA virus. So Nipah virus is a negatively sense single stranded RNA virus. It belongs to the family Paramyxoviridae. Within this family, it comes under the subfamily Orthoparamyxoviridae. Within this subfamily, it comes under the genus Henipavirus, in which two main viruses, Hendra and Nipah virus, belong. So, discussing about its mode of transmission, it is a zoonotic disease with mortality rate of approximately 40 to 70%, having natural host pigs, fruit bats, horses, and dogs. It is transmitted through the infected pig to the farm workers and through infected fruit bats, also known as the pteropods, flying fox, that cause contaminations of the fruit of dead palm sap through the saliva, which is ingested by the healthy person, that cause the infection, and through the human to human transmissions from the infected person to the healthy person. So, what are the clinical features of this infection? It has incubation period ranging from the 4 to 14 days, mainly involving central nervous system and respiratory system. In central nervous systems, on day 1 of illness, it causes the altered sensorium, also fever, headache, dizziness, seizure, hallucination, abnormal dull eye reflexes. In respiratory symptoms, it causes cough, acute respiratory distress syndrome, and it can also involve the gastrointestinal and renal in 5% cases. For the diagnosis of this infection, we can do complete blood count, in which we can appreciate thrombocytopenia and leukopenia. Further, we can do liver function test, in which transaminase level is increases. It mainly affects central nervous system, so cerebrospinal fluid analysis is mandatory, in which we can appreciate lymphocytic pleocytosis, increased protein level, and glucose level is normal or mildly reduced. We can do serum IgM capture enzyme immunoassay, which detect IgM antibody in blood, which indicate recent or current infection. Further, we can do IgG indirect enzyme immunoassay, which detect IgG antibody, which indicate past infection or previous exposure. For the confirmations of diagnosis, we must do RT-PCR by taking sample from either cerebrospinal fluid or blood or serum or throat swab or urine, which detect specific RNA sequence for Nipah virus. We can do chest X-ray, in which bilateral lung infiltrate with basal atelectasis is seen in many cases. Further, we can do MRI of head, which show punctuate hyperdensities, which is due to the vasculitis that causes the microinfarction in the brain. Talking about management, there is no any specific vaccine and specific treatment for this infection. There are only supportive treatment for the infected case, but some improvement in patient with the uses of the ribavirin in one new drugs named M102.4. This is the monoclonal antibody against Henipavirus G protein, which are currently in phase 1 trial. We know prevention is better than cure. In prevention, stay away from pigs, bat, or domestic animal in endemic area. Do not consume fruits that are partially eaten or bitten by bats. Avoid drinking raw dead palm sap. In healthcare setting, use standard infection precautions like hand hygiene, gloves, masks, gown, eye protection, proper disposal of contaminated material, prevent human-to-human transmission by isolating suspected or confirmed Nipah patient, avoid close contact, do not share food, utensil or personal items. Caregivers should wear appropriate personal protective equipment. Thank you. If you like our video, please subscribe to our Medicals Library channel for this type of informations, and you can follow us even in Instagram and Facebook.